know that feeling
Hmm.
when, like, a cornerstone of your small town just starts to crumble?
Hmm.
For so many rural places, that really hits home when the local doctor, the one who's been there forever, decides to retire.
Oh, absolutely. It leaves this huge void, doesn't it?
It really
And
does.
it's more than just like an inconvenience. It can seriously ripple through the whole community.
Yeah, affects the economy, how secure people feel, everything.
Right.
So for this deep dive, we're not just going to rehash that familiar problem. We want to dig into how some really, well, ingenious towns and rural areas are actually tackling these healthcare shortages.
Grabbing the bull by the horns, so to speak.
Exactly. Finding innovative ways. We got some interesting stuff to look at, key strategies, and also the work being done by Healtheon.ca.
Yeah, Healtheon's approach is interesting because they really focus on empowering the communities themselves.
Right. Letting them shape their own healthcare solutions, not just waiting for someone else to fix it.
Hmm.
So our mission today is really to get under the hood, understand the key ingredients making these community-led models work, for the long haul.
How they're building systems that are actually resilient, designed to last.
Okay, so to understand that, you kind of have to start with this idea of being proactive, right?
Right. It's often called a healthcare master plan or maybe a community health improvement plan. Different names, same idea.
And the big shift here, it seems, is moving away from just reacting.
Exactly. Stop patching things up only when a crisis hits, like that doctor leaving.
And move towards something more strategic, thinking ahead about the community's overall health needs, building something solid.
Precisely. And there are several key parts that make up a plan like this. Think of them like pillars holding things up.
Okay, let's unpack those. First up is healthcare facilities planning.
Yep. So this isn't just about the clinic you have now.
It's looking ahead.
Right. Making smart calls about where services should be, what kind of buildings you'll need down the road, long-term thinking.
Makes sense. And tied right into that is workforce development, I assume.
Oh, absolutely critical. You can have the best building in the world.
But if there's no one to staff it?
It doesn't do much good. You need the doctors, nurses, all the allied health professionals, the people.
Got it. Which leads us to number 3, health needs assessments.
Yeah, you can't just guess what the community's dealing with.
You need data.
You need the data. Are diabetes rates high? Is getting healthy food a problem? What are the real challenges here?
Understanding those specific issues,
Okay, and building on that, you get to access to care.
which is broader than just having a building and staff.
Much broader. It includes things like how do people actually get there? Transportation.
Yeah. Insurance coverage.
And just having enough providers available so people aren't waiting months for an appointment.
Then there's public health infrastructure.
The unsung hero. This is all the background stuff that prevents illness, promotes wellness for everyone.
Keeps the community healthy overall.
Exactly. And number 6 is integration of services. This is a big one.
Making sure all the different pieces talk to each other.
Yes. Your family doc, specialists, mental health, social workers, everyone working together.
Not operating in their own little silos.
That's the aim. Seamless communication.
And that seamlessness kind of paves the way for number 7, digital health infrastructure.
Which isn't science fiction anymore, right? It's here now.
Telemedicine, you mean? Connecting doctors and patients remotely.
That, plus secure shared medical records, maybe even using AI tools smartly to boost efficiency.
Interesting. Okay, and finally, the 8th pillar.
Gotta be funding.
Right. How do you pay for all this?
You need sustainable models. Maybe it's grants, maybe public-private partnerships, maybe community initiatives. Finding ways to keep it going.
Okay, that's a really solid framework. 8 key components. So let's bring it down to earth. Let's take a specific example. Picture this. A town, maybe 5,200 people.
Okay.
And their only family doctor, pillar of the community, retires. That's a tough spot.
It's a huge shock. Yeah. But what's cool is how this one community reacted.
What did they do?
First, smart move. They secured the clinic space itself.
Kept the building.
Realized that physical infrastructure was absolutely vital. Step 1.
Then they started building a new kind of team, right? Not just looking for one replacement doctor.
Exactly. They hired admin staff, nurses, and even an internationally trained clinical assistant.
So diversifying the roles.
Right. They embraced what's called a team-based care model.
How does that work, practically?
Well, the patient care duties get shared. The doctor can focus on the really complex stuff.
While other qualified people handle other important aspects?
Precisely. It makes things way more efficient.
And the results? Did it work?
Get this. They doubled the clinic's patient capacity.
Doubled it. From what to what?
From about 1,500 patients to serving 3,000.
Wow. How? Just the team model.
That was a big part, but they also made it really attractive for new doctors to come there.
Okay, how'd they do that?
They took over the clinic's overhead costs.
Like rent, utilities.
Yep, rent, utilities, even helped with staff salaries. That takes huge financial pressure off the doctors.
I bet. Anything else?
Yeah, they offered really good benefits packages,
Yeah.
including things like healthcare pensions.
Oh, that's a big deal for retention, isn't it?
Huge draw, provides real long-term security.
And then they brought in tech through healtheon.ca.
Right, secure messaging between patients and the team, online booking,
Convenient stuff.
and even this cool voice assistant thing, apparently really helpful for seniors managing appointments and refills.
Okay, now for the kicker.
Yeah.
What did this cost the town annually?
This is the amazing part. It worked out to just $1.95 per resident per year.
No way. Seriously, less than $2 a person.
That's what the numbers show.
How is that even possible? Is it just using the old clinic or?
Well, that helped, definitely, but it's also about being proactive, using that team model efficiently, leveraging tech.
Avoiding those costly emergency measures when things fall apart.
Exactly. Strategic spending, community commitment, it all adds up, or rather, keeps the costs down.
And they didn't stop there, did they? They added wellness plans.
Optional ones, yeah, for like $20 to $40 a month.
What do you get for that?
Access to uninsured services, health coaching, extra support.
And that money helps the clinic too.
Potentially, yeah.
Yeah.
Think about it. If maybe 1,000 people signed up for, say, a $30 plan.
That's $30,000 a month.
Mm.
$360,000 a year.
Right. And where does that money go?
Back into the clinic.
Mostly, yeah. It creates this kind of community-driven funding engine. Makes the whole thing more sustainable, less reliant on waiting for outside money.
That's a really smart model. But what about the really small places, towns that maybe don't have 5,000 people or the resources to kickstart something like that?
Yeah, that's a real challenge. And that's where this hub-and-spoke model starts to look promising.
Hub and spoke, like for airlines.
Kinda, yeah. Imagine smaller local clinics, the spokes,
Okay.
connected digitally to bigger regional centers, the hubs.
For specialized services.
Exactly. And the tech makes it seamless. You might see a specialist virtually without leaving your local clinic.
We even see access issues in big cities, though, like Ottawa, you mentioned.
Right. Even in Ottawa, with tons of clinics, something like 150,000 people don't have a family doctor.
That's staggering.
But it shows where efficiency can help. Healtheon worked with a large practice there.
Yeah.
They managed to boost patient capacity by 15%,
While cutting admin work.
by 25%.
How'd they pull that off? What specifically changed?
It boils down to using tech smartly, automating reminders, digital forms, better communication tools.
Stuff that frees up clinician time for actual care.
Exactly. Less time on paperwork, more time with patients. It shows you can optimize even existing setups.
But this problem in rural areas,
Mhm.
it's deeper, isn't it? This silent crisis idea.
Yeah, it really is. It's not just, oh no, the doctor left. When healthcare goes, people start leaving too.
And then economic opportunities dry up.
It's a downward spiral sometimes.
And communities are spending a fortune trying to plug these gaps,
Yeah.
right? What was that figure for Ontario?
An estimated $481 million annually.
Wow. Spent by communities on healthcare that arguably the province should be covering.
That's the argument, yeah. It's a massive burden on local taxpayers.
And it's not just about getting new doctors in. It's about keeping them.
Right. Dr. Danica Switzer made that point. Retention is just as critical, maybe more so.
Creating environments where health professionals want to stay.
Support, incentives, work-life balance.
But despite all that, there are success stories popping up in rural Ontario.
Oh, definitely. Some really inspiring stuff.
Like what?
Well, these community-driven clinics we talked about,
Right.
where the town itself takes charge.
Renting or buying the space.
Yep. Hiring the whole team, using tech to extend care, taking ownership.
And funded partly by the residents themselves sometimes?
Often, yeah. Those monthly contributions create stability, like a community subscription.
What else is working?
Virtual access to specialists is huge. Partnerships like Healtheon and RCM Health.
Giving rural patients access to thousands of specialists online.
Over 4,000, yeah. Without hours of travel. That's a game changer.
And AI is playing a role too.
Increasingly. helping with clinical decisions, second opinions, personalized coaching, even online mental health support.
Making expertise more accessible,
And we're seeing creative insurance options emerge, too.
like that $10 a month plan you mentioned.
Yeah, offering $10,000 for critical illness. It gives people more choice, maybe faster access for some things, alongside the public system.
So zooming out again,
Yeah.
nationally, we need more of this kind of innovation, right?
Absolutely. We can't just keep doing things the same way and expect different results.
What kinds of things should we be exploring more?
Well, public-private partnerships could be one avenue. Maybe that build and operate transfer model for certain facilities,
Using private sector efficiency, but keeping public oversight.
potentially. And just relentless digital optimization everywhere, making the system smarter, faster, easier to navigate.
And community-governed health funds, letting local areas tailor things.
Empowering communities to address their specific needs. It makes sense.
And this isn't just theory. Other places are doing this, like Australia.
Yeah, Australia's had some notable success with similar innovative approaches. It shows it can be done.
So if we look at the communities really making progress, what are they doing right?
A few clear things stand out. First, they really understand their local data. They know their specific needs.
Isn't that geffing?
Second, they focus their solutions. They target those identified needs strategically.
And third,
They build partnerships. They don't try to do it all alone. They collaborate.
and the big takeaway seems to be, it's not just about throwing more money at the problem.
No, it's about spending smarter, addressing the root causes effectively, building for the long term, sustainability, resilience.
Which really brings it back to the listener, doesn't it?
It does. It raises that question. What role will your community play in shaping the future of healthcare?
Are you going to be part of finding these kinds of solutions?
Something to think about. Thanks so much for taking this deep dive with us today.
Let's keep building better together.